Athletic shoes play a very important part in reducing injuries, and they are also important in the rehabilitation process. One of the most common injuries that we see in our running and physical therapy clinic are medial shin splints. Those people suffering from medial shin splints usually have pain on the medial side of the lower leg here. You can also see it in this picture here. That happens to be the right foot, and that you tend to have increased pain in that area. So one of the most common things that we find in the individuals that have this condition is that they have very tight posterior calf complexes. In other words, they're very tight in the calf muscles here. So that increases what we call the eccentric loading on all the tissue on the medial side of the lower leg. And when I'm talking about eccentric loads, what it is it's pulling on all that tissue and it's irritating it. So along with the posterior calf muscle, tight posterior calf muscle, tri-motions in the foot and ankle also increase the eccentric loads on those tissues. The tri-motions are pronation, tibia internal rotation, and dorsiflexion. So Tommy, if you can come real close here. So during the weight-bearing phase of gait, as you start to pronate downward and the tibia internally rotates, and then you dorsiflex, you're moving forward, you're constantly stretching on this tissue. These tissues are muscles, tendons, periosteum that surround the bones. And so that constant repetition increases the inflammation. So how does a shoe help in reducing this condition, besides a good exercise of strengthening and stretching program? Well, the thing that a shoe can do is it can have what we call a maximum loaded heel to toe ratio in the weight-bearing phase of gait. In other words, the heel is higher than the forefoot. As soon as it moves into that position, it reduces the eccentric loading on those tissues that I'm talking about. The second thing that the shoe should have is a high shoe stability index, and that reduces pronation and internal rotation. And that also alleviates a lot of the eccentric loading on those tissues. So that is the type of shoe that you want. So let's go over to our shoe index, and let me show you what we look for in a shoe. We call all of our shoes from the minimal shoe stability index all the way up, and it becomes a maximum shoe stability index. Usually these shoes in this area, I call them the therapeutic level of running shoes. They have a high motion control stability index, and they have a maximum loaded heel to toe ratio. Those things that we're looking in a shoe that's going to help reduce the eccentric loads on the lower leg. So if we're looking at the women's shoes, we would look at the Brooks Adrenaline, which has a high motion control stability index and a maximum loaded heel to toe ratio. Another one is the Brooks Aerial. Another one is the New Balance 860 V8, which is a great shoe. And we can look at the Wave Paradox, which is a good shoe. So knowing the shoe structures of a shoe, you can integrate it with the different injuries that individuals get. In the future, I will do a video on different injuries and the type of shoes accordingly to the structural parameters that would be beneficial for that recovering from that injury. So if you have any questions, please go to our website, www.shoetutor.com, and it will give you a good insight on what we do.